So I'm going to start off my treatment by putting pillows underneath your knees. Is that okay with you? So I'm going to pick up her legs, place the pillow, and she doesn't want a pillow underneath her head. So I'm just going to leave this. Are you comfortable?
Yeah.
Okay, so then we're going to start off by just some warm-up techniques and do some stroking all over the body. And just imagine I did it on that side too. And we're going to start off. This patient has nerve lesions in her left hand. So when the person has nerve lesions, you want to address any compensatory changes. So I'm not going to show you this part because I know you know how to do it. You want to address the entire back, upper back, and neck. But we're going to start with just the nerve lesion on her arm. So we're going to undrape. I'm going to undrape this arm. Is that okay with you? So I take her arm out. And we're going to do each one. So the first one I'm going to ask my patient, because she doesn't actually have the nerve lesions, I'm just going to explain to her that your hand is like this and you're unable to really keep it in a neutral position. So because she can't do that, I can use a towel. She has a wrist drop, which means that she has a radial nerve lesion. So I can use a pillow or something to help her keep her hand in neutral. So this is how I would position it. I'm using oil to start to work on my patient today, but before I do that, I'm going to do some frictioning techniques. So in a radial nerve lesion, she has contracture tissue on the anterior forearm, not on the posterior forearm. So we might have to have her switch this way, adjust the pillows a little bit. This is where I'm going to apply my fascial technique. So I'm going to start off with a fascial technique. It can be painful, okay? If it is painful above your tolerance, you just let me know and we'll stop. In order to do the fascial technique, you will feel a burning sensation, okay? So fascial technique, first I'm going to assess my tissue superiorly, medially, laterally, and inferiorly, and note my restriction. So this whole area is restricted because she has that radial nerve lesion. So I'm going to apply my fascial technique. I'm going to start off with some skin rolling. Throughout the tissue. So I'm going to do this on the entire forearm. And I can add in other techniques. If I notice any particular areas, I can do my torquing, C bowing, S bowing. I can do my fascial stretch and my fascial crosshand spread. So there's my spread. You feel okay? So you're getting feedback from the patient. That's our fascial technique. We've loosened up the fascia. Now we can start to work on the area with oil. So I'm going to start off by applying the oil on her. You know, warm up the entire general area. So I'm doing my effleurage technique. And I'm going to start off with doing the superficial, deep superficial first on the proximal joint. So I'm going to be doing some kneading to warm up this area. Keep in mind the radial nerve really goes down the posterior arm here, along the posterior arm here, and to the dorsum of the hand. So in this patient, all of these structures are very flaccid. All of these structures are very tight. So these are the structures that I need to perform my techniques on. So on the flaccid side, I can do my tapotement and my stimulating petrissage techniques. But on the opposite side is where I need to do a lot of my trigger points, fascial techniques, and friction. So as I perform this technique, I notice as I'm doing my stripping, I warmed up this entire area, and I find that I have a trigger point. So I'm going to let my patient know that I feel a trigger point here. This can be a painful technique. I'm going to try to keep you below a 7. So on a 0 to 10 scale, 10 is the highest pain, the most pain you've ever felt in your life, and 0 is no pain. Okay, do you understand?
Yeah.
Okay, so she understands. So now I'm going to start to press, and she says she's at a 7. We're going to keep her here. Let me know when you're down to a 2. She's at a 2, so I'm going to repeat the technique. She's at a 7. She's at a 2. I may need to reinforce, go a little bit deeper as the trigger point is reducing. She's now at a 7. and she's at a 2. I'm going to then flush the area. As I flush through the anterior forearm, I can now stretch it by doing a wrist extension. 29, 30 for 30 seconds, and I can place heat on this area here. After my trigger point technique, I noticed that she has some adhesions. She has adhesions at her medial epicondyle. So at the medial epicondyle is where I'm going to apply my friction technique. This technique is also very painful. I'm going to be frictioning now. Is that okay with you? Yeah. So I find my medial epicondyle, I do my reinforced fingers, I apply the technique. And I can do this for up to 2 minutes. And then I would take a break and I can continue it for 20 minutes. My patient feels okay. And then I stop my technique, flush the area. Again, I can stretch out the medial epicondyle by extending the wrist here. And I can place ice here to reduce any cold or inflammation. So for my joint mobs, our patient is in a radial nerve lesion. So her hand looks like this. So her hand is already in flexion, so we are trying to increase extension. It is a convex on concave, so everything is in the opposite direction. In order to increase flexion, you are going to be doing a posterior glide. Sorry, increase extension, you're going to be doing an anterior glide. So I'm going to traction the joint. I'm going to be doing this to increase the joint mobility. You have to let your patient know why you're doing it. Do the grade 1 traction. She doesn't have any pain, so I can go ahead and do my anterior glide to increase my extension. Grade 1, grade 2, grade 3. Keeping in mind my joint is already in loose pack position. It's between slight flexion and extension and ulnar deviation. So that is the loose pack position for the radiocarpal joint. And getting her feedback, you feel okay, feel good, and taking her back to neutral. And there we go. Those are I did my joint mobs, I did my friction, I did my trigger point, and I did my fascial technique. Good stuff. The last thing I want to show you is the nerve flossing technique. So in order to floss the nerve, we're trying to mobilize the nerve in the position that it stretches in. So a radial nerve is like this. So it's ULTT3. Remember, with ULTT3, the patient's neck is going to be contralaterally side flexed. So I did that. I'm going to depress the shoulder. The shoulder is in 30 degrees abduction. 30 degrees abduction, the elbow is extended, the wrist is flexed, and the fingers are going to be flexed inwards like this. As she does this, I'm going to just apply overpressure. And the patient should be feeling a stretching symptom. She should be feeling her neurological symptoms right now. And as I do this, I'm just going to take each joint and move it out, mobilizing the nerve. So by doing this, I am mobilizing the radial nerve at the wrist. I could then move to the metacarpophalangeal joint. So I'm going to hold here, flex, and extend the metacarpophalangeal joint, mobilizing the radial nerve. Continuing on to each individual interphalangeal joint. And that will help to mobilize the radial nerve.